Hello, good evening, televiewers. You welcome to this other edition of Prime First for this week. We this Monday are going to be looking at the situation of COVID-19 with its resurgence in Africa, Cameroon, particularly with lots and lots of dilemma, twists concerning the proposed vaccines for people to immunize themselves from this virus that has claimed thousands of lives across the globe. We are going to be discussing this evening with Dr. Nick NGWANYAM, who is going to also help define to us what this COVID-19 is all about and why it is becoming the more difficult to understand how to go about it. Dr. Nick NGWANYAM, who is an educationist, he is a medic and also a politician. We are glad to have you this evening with us.
Thank you very much, KUM, and good evening to our listeners.
Yes, I'll go straight to our discussion for tonight, which has to do with this COVID-19 resurgence. Many persons are really taken aback. They are confused as to what is happening.
I think everybody is confused. I'm confused.
Okay.
And even the people making the vaccines are confused. Presidents are confused. Small states are confused. Big states are confused. Why is everybody confused? Because we don't know the truth. That's the bottom line. When you don't know the truth, then whatever you say is questionable. And it's only when you answer questions in the affirmative that people can actually follow you. But when they ask you specific questions, when the answer is I don't know, then it becomes very, very confusing for everybody. And that's the thing. So if you were to push me now to the wall, I would just tell you I don't know.
You see, you don't know. I followed a medical doctor the other day who said that this new phase of COVID-19 is very different from the former because it is difficult to actually put your hands on how it operates.
Well, first things first, we don't even know where the COVID came from. If we don't know where it came from, and I don't know, maybe I should ask you and our listeners out there, do you know where it came from? Is it a natural virus or did it come from a laboratory? Is it a Chinese virus or an American virus? You see, so yes, there are things about it now we can't say. People say there are variants of it. You and I don't know how the variants look like. We have no clue even what the first one looked like, and we don't know where it came from. So we can only follow what everyone else is saying and echo it, but we lack the technology to the extent that you and I can say what it is.
But looking at the symptoms, you did some videos formerly when this the virus took the world by surprise. You came to the same studios advising on how to prevent it. But now when they talk about the new variants of COVID, they say it's asymptomatic. It suffices that you have headache, you have malaria, symptoms like that, and you just need to rush to the hospital. Eh?
It's really very, very tricky because with the other COVID, you know, they tell you this when you have this package, you know, this group of symptoms and signs, you're more likely to have it. But with a new one, we hear that you don't have to have all of that, and we are meant to understand that it has no age barriers and that it's more deadly and so on. But again, when we were still dealing with the first one, you know, someone told us that another variant is going to come which will be worse than this one and that would kill, and that the first one did not seem to kill as it was hoped. So, you know, there are all these theories, and as long as we don't know, you know, who started it or how it started and where we are going to and what the motives are behind the existence of this COVID-19 virus, is going to be very tricky for everybody.
This new the second wave that we are living today, they say it's more deadly. It doesn't take at times not up to 10 days, just 3 days is enough to knock you off. Yeah.
Well, you know, we've been noticing some kind of things, like, you know, there were statistics that came up from the Northwest, and they said that Nkambe, a place that was very quiet, is topping the list in COVID-19 cases. And then I've heard of some strong people who just died, so that is very, very frightening. And but again, it's very, very difficult to know what's going on, and we just have to keep on saying that prevention is better than cure. prevention is better than cure, and whatever you can do to stay healthy is the best thing to do. If we keep arguing on where did it come from, how is it like, and so on, probably, there's so many people out there who don't believe that it's a reality and they still joke around with their lives. So let's continue to insist more on the prevention, whether we know where it came from or not, whether we know how it looks like or not. Even if we knew everything about it, prevention is still better than cure.
Are there good reasons for many persons to be skeptical and scared as we speak, especially not knowing where it comes from, by persons like you who are professionals in the field?
Yes, one has got to be very careful, and I think it's a great idea to make sure that you are on the same footing with your God. We don't see this thing. It's so tiny, and it can get to you anytime. And and once you have it, you have no control of what is going to happen to you. So for people who don't believe in God, I feel very, very sorry for you. Believe in God. If He protects you from having it, great. If you have it and He helps you overcome it, great. If you have it and you die, at least be sure that you are going to heaven. It's a very tricky thing.
Now, we saw a mad rush for the search for a vaccine at the advent of this vaccine. Almost every nation was rushing to look for a vaccine, and many persons are asking the questions, why this mad rush when we have diseases like diabetes that are taking lives every day, cancer, and a host of others?
It's very, very tricky. It's really very tricky.
Why don't we also see that same energy
put into the other diseases?
Yes.
Well, if you see the rapidity with which this virus tends to kill, one can understand why we have to go so fast. You have a window of 10 days, 14 days or something. You have to do something about it quickly. And then you are telling me that even that time period is getting shorter.
It's reduced to 3 days.
Yeah. So that is really pretty tricky, and that is frightening. And therefore, when things are so tricky and don't give you time to think, then you've got to also change the attitude that you have towards it. You have to pay it more attention. But you and I are on social media, and people are asking some intelligent questions. What suddenly happened to man that he can discover that he can come up with a vaccine for this disease that just came up the other day? And yet we've been around with HIV for 20 years, and for 20 years, and nobody's doing anything about it. So is humanity just wicked or something? There's something somewhere that doesn't add up.
Yes, but that's what I was asking. Cancer kills every day.
Yeah.
There are lots and lots of people who are dying from cancer. I know.
Yeah.
Diabetes, they are dying every day. I know some of them.
And other infectious diseases. Yes. And then even forget about that. Let's just come back to Africa. You saw that there was a picture on WhatsApp of some kids, some malnourished kids with some mask on. And the story behind it is Africa, more people are dying from hunger than from whatever disease, and we all as a people know the medicine or the vaccine or whatever that we've got to put in place to fight the deaths from hunger. And yet we are doing nothing about it. What is at our reach, we are doing nothing about it. Okay? And we wake up and then we're running after something. And given that, because we are also not eating well, even if that virus comes, our immune systems are so weak that it will kill us. So we are trying to say that it's a package deal. And while you are running after the virus to do something about it, they are and because the virus is even more intelligent than we are, there are those things that we ought to be doing to strengthen our health systems, and our environment that we are not doing. Okay, we just sit there and wait. What is the white man doing for us? But the little things that you and I ought to be doing, we are not doing. That is where the problem is. It's a huge problem.
It is a huge problem. But since the advent of COVID-19, have you seen a national or African policy that seeks to better the hygienic conditions of the African himself, so that at least why not just get ourselves better than prevent any possibility of any such attack?
That's the problem. That's the problem. We still cannot manage cholera. We cannot manage malaria. We cannot manage tuberculosis. We cannot manage many of these. We cannot manage diarrhea diseases. We don't have running water, and we have dirt all over the whole place. And I was just so happy that with the advent of the COVID, you know, there was this outcry for hand washing and then stopping people from shaking hands and so, because shaking hands in itself had become a disease in this nation. You get into a room with 50 people and you have to shake the hands of 50 people. And I mean, when the COVID came, you know, we broke that bad habit. So we have some of these bad habits that were stopped by virtue of the presence of the COVID. But when the disease kind of like piped down a little bit, we picked up with some bad habits again. You know, mixing in large crowds, crowding in market areas, crowding in buses, and then sometimes, you know, what the white man would prescribe out there as a measure doesn't fit in our own environment, because our lifestyles are completely different. We are overcrowded in our homes. Our towns are not planned. There's no running water. The sewage is so poor. So when you try to bring those and say there should be only 2 people in a room or something like that, and whatever, it doesn't work, because you have 5 people sleeping in one bed. It's a very, very tricky thing. But we ought to start to do something about our lifestyles, so that when things like COVID and others come, we'll be able to manage them. What I'm saying is that we have a lot of homework to do as far as our hygiene, our living conditions are concerned, as far as providing potable water is concerned. And if we don't do the basic things, when a disease like this comes, it just shows that the king is naked and we are severely challenged.
We are severely challenged. We understand that 7 European nations have suspended the use of this vaccine, AstraZeneca. And as we speak, we're getting information that France is also taking that decision to halt its citizens from taking the vaccine, that they are waiting a decision that is going to come from a European Commission of Medics. A right move? Is that also the move that Cameroon should take as we speak?
Yeah, let's say that I think there are just about 2 vaccines in the market now. There is that AstraZeneca, that's from Britain, is it not?
Yes, from Britain.
And then there's the other one from Pfizer. From Pfizer, I've forgotten the name. Yes. And, you know, and then I heard that there's another country that is trying to come up with another vaccine, but the technique for producing that vaccine is different from the technique that has been used by Pfizer and this other company that is produced this AstraZeneca or whatever. But what shocks me most is that I read on social media, it might be true or might be false, that the president, the CEO of Pfizer, who has produced this vaccine, he comes up with a political statement to say that he is such a nice person, that he should not be taking the vaccine, and he and his staff should not be taking the vaccine, and that this vaccine should be sent to frontline workers, and that if the few of them who are in Pfizer, if they were to take the vaccine, they'll be depriving frontline workers from it. So somebody makes something that is to help people. Somebody makes something that is so good, and he doesn't taste it himself. You cook your own soup, I don't want to taste it. That's very tricky.
That's very tricky, but we've seen in the United States of America, we saw current President Joe Biden and the Vice President taking the vaccine in public on TV. In Africa, we saw the likes of Paul Kagame also leading by example.
That's
if this vaccine were to be administered in Cameroon, do you also expect the leaders, the leaders to lead the campaign?
Well, I think I'm so happy that the Minister of Health is very cautious. He's a very cautious man. And when the Prime Minister was talking about the vaccine, he said that it was not obligatory. That's a nice political statement, because it gives a window of escape. Because if they were going to say it is obligatory, then we will need to line up everybody, starting with the President of the Republic, the President of the Senate, the President of the National Assembly, coming by order of protocol in the nation until once we are finished with the protocol. Like when you have 20th May, you don't see doctors and nurses on that grandstand. We will expect that everybody who comes to the grandstand everywhere in the nation is vaccinated, plus MPs and so on. Then the doctors and so on can come, because I think those are the frontline people in our nation. They are politicians. Yeah.
Yeah, but even if the vaccine was not to be made compulsory in Cameroon, would it not be nice that those who are leading, telling people to take it, to start by taking?
Yes, it would have. Yeah, and don't forget, have you also seen some videos where people pretend to be injecting some of those big people and they don't really inject? They do something. It's just,
at least symbolically. Let's be seen as taking them. Yeah.
Okay, but what you are saying is that the vaccine should actually be put in the syringe and not water for injection, and they should be injected. Yeah, that would be a sign of that you stand with the people, because it will not be fair that you allow your people to be led to the slaughter, and you, who is supposed to be the shepherd, you stay behind. That would be an act of betrayal and dishonesty. So I think it's the right that even if the thing is voluntary, the authorities should take the vaccine as a sign of encouragement to the people who are going to take it voluntarily.
Now, Dr. Nick, we saw the Minister of Secondary Education recently, 2 weeks ago, come up with a communique stating that students, secondary school students, are supposed to do the tests, and that the admission into the different campuses around the nation is supposed to be determined by the presentation of such a note certifying the fact that they have taken it. Was it a wise move?
Well, it's a wise move in a nation that lives by principles and standards. But you know that if she were to put her foot down, half of those certificates will be fake. You know what I mean? And also, we do things in this country and we don't really tell people where we start and where we stop. I'm still questioning what happened to the results of those Congolese players and their coaches. Just before they played the Cameroon match, in the morning, I think about 10 of them were positive, and the evening, after the Congolese people made a lot of noise and threatened, by evening only 2 or 3 of them were positive. So nobody is telling us what exactly happened, and nobody is telling us whether next time we'll do better than that. If our margin of error is so wide, then it's very tricky. And I've also understood that there are so many people who die and they are labeled as having died from COVID-19 when the results have not come back, and sometimes they are inconclusive and so on. So there's a lot of gray areas in this thing, and one doesn't know.
Dr. Nick, but if a student were to take this test and then is given access to a campus, but it comes back to live in communities, how does that work?
That is the point I was going to ask. When the minister says they should bring that result, she probably should add to it that every two weeks or every 3 weeks, you should repeat the test or something like that. Because we could take the test now. We could take the test now when I'm in the window period, and then tomorrow I become COVID positive. Or we could take the test now, given our living conditions, overcrowding in taxis, motorbikes, and what have you, I can get contaminated down the road. But I guess what she's saying is that we should do the test, and so that people who are overtly positive should be kept home or in isolation centers and treated before they join the schools.
Now,
but I would think it's a better move than to shut the schools down.
Okay, your assessment of government's reaction to COVID, the first phase of COVID-19 that we were almost forgetting in Cameroon.
Well, when the COVID-19 came, it was a new disease and nobody knew where it started and how it was going to end. So it was kind of like this navigation à vue, and there was a lot of unaccountability in many areas and so on. Everybody was just trying to do their best, and there were a lot of mistakes made. And did we do our best? I'm not so sure. And I keep saying that we were not hit as much as many countries, not because we were great, but because God loves us.
because got lost us, Dr. Nick. Now, but when you look at the reaction of the government, because you see, the first phase was we were taken aback, the entire globe.
Yeah.
We saw it, and emergency centers were erected across the nation, which eventually got dismantled.
Yeah.
Was it a wise move to have dismantled them at Susu?
Well, because just like we do our things, we took the things and we put them in the stadia that have to be used. And if we had, this is it. We have a lot of land, and government has a lot of land. Sometimes we don't think things through. You see what the Chinese are doing. The virus is declared. They go out there, get some land, clean it up, and then erect those things overnight. Those buildings they're prefab. They're prefab. It's not like they're concrete buildings. They're prefab. So a wise move would be get some land somewhere, create infectious disease, some quick infectious disease hospitals, you know, out in the periphery where you have a lot of fresh air. So that in a place like Douala, you could, you know, Douala is quite big. You could create one in about 4 corners of the town where there's open land. Just go there with a bulldozer, clean the thing, open the road that's going there, you know, cement the place, put some gravel there, and then cement the base, erect. Prefab houses are built in 2 weeks or less, and then we take the things because of our laziness and inability to think out of the box. We go and put them inside the stadia, and then we have the decor of the stadia giving it this beautiful look, and then we have to dismantle them, and at the end of the day it's lying somewhere, and those things cost a lot of money. So we don't really think things through.
Now let's look at the preventive measures. We are told not to to visit overcrowded areas. We are told to wash our hands, to use masks. Have you seen videos of ministers in this nation circulating on social media with very little regard to these preventive measures?
I saw another. I think I saw a media. There was
2 ministers.
There was I think it was the Senate in the Senate. You know, this Senate meeting something. I saw one big minister there. You know, and he wasn't wearing his mask. He didn't. It looks like everyone else was respecting the rules, but you know, when you are the rule itself, you don't respect it. You see what I mean? Because the COVID, you know, respects the guys.
Personalities.
Yeah, you know, the COVID in Cameroon respects personalities, so you can't blame them.
No. What message are you passing across?
Well, I'm saying that COVID knows who is big and who is small, and the laws are meant for the small people. You get what I mean? Yeah, COVID knows the big people and the small people, and COVID only attacks the small people, and only the small people transmit COVID to others, and some people are above the COVID. That's what I'm saying.
Now, if you were to advise on, because students are in schools as we speak, what would you tell them to do?
It's you know, during the first phase of the COVID, I found it very difficult because I run a school, and it's very, very difficult to really control the behavior of young people. Even in university, it's very difficult. The tendency to congregate is very, very high. And you know, sometimes you would take very nice pictures of them sitting in class because the benches have been put where they are, so they sit there and put the mask and they're looking so good. As soon as they go out for break, all of those rules are broken down. So it's a very difficult thing to handle, and well, you can't really blame them, because as they leave and are going home, they're going into those crowded environments, and they just disappear into that milieu, and they are part of nature.
And when you look at our markets, the Minister of Transport recently said that people who would not be putting on masks in transport, buses should not be allowed to travel. But even with the mask, given the sitting positions in a bus like 70-seater, how does that work?
Yes, I have noticed. I mean, for the 70-seaters going between Douala and Yaoundé, I've noticed people have traveled by those buses. You know, everybody's kind of like very conscious, and then they put on their mask, and then you know, people who care for their own lives, they put on their mask, they sanitize their hands. And
yeah, but what of these vehicles that fly Douala, Bafoussam, Douala, Bamenda?
I'm not so sure. Okay, by day, there might be a semblance of respecting those rules, but if I were the government, I would start off by banning night journeys, because the night journey, for the night journeys, the windows, you know, for those going up country, is very cold, and you've traveled by night sometimes, all the windows are closed and air is airtight, and many of them don't have air conditioning. So that is a very beautiful environment for the transmission of the virus at night. Especially also, I stopped at Marché Central here in Douala, and I was very scared because there's no ventilation in that market. No, I think somebody should do something about it. Go check the Douala market. It's not Marché Central in Douala is not ventilated at all, and there are so many people crowded there. That place is not ventilated with so many people. It's a highly risky area to be at.
Yeah, would you say the government is doing enough at the local level? What should municipal authorities do? Because take the example of the Marché Bonamusa. Do we need the minister to come and tell people what has to be done?
It's very unfortunate because your question reminds me about something that I ought to say here. During the first phase of the COVID, there was this show where you would the market would be closed, and then these big machines would come and
pump
spraying the whole place. That made me laugh. And then even in Bamenda and many other schools too. Like in Bamenda, there was the firefighting brigade. I don't know what they put in those their firefighting equipment. They went to Kasbambli and were pouring water the whole time. Now, when you understand how the virus is transmitted, when you understand what is going on, you realize that it's a waste of time. Okay, let's just go to the Marché Bonamusa, what they did last time. The women, they took these plastic papers. Like when they're closing from the market, they always take these plastic papers and cover their stuff. So you come in there and then you spray something and then you go. Everything on those tarpaulins and so on are still as contaminated as they were yesterday. Though you try to put some water, I guess the water has got La Croix in it or something, or eau de javel in it. I don't know what they use, but this is the point. You just have to. People just have to come there the next day and do exactly what they have been doing, and in 2 hours the market is contaminated. Is it making some sense? Yeah, that's the point. And so the droplets would fall everywhere and so on. So take for instance, somebody asked me a question about there was an issue here where a mayor wanted to shut down schools and disinfect the schools, and then he had problems with the SDO. Yeah. Then I broke that activity into two to look at the technical part of it, the shutting down of the schools and the disinfection. And I was going to ask the mayor, how often are you going to disinfect the school? Because if you tell me, if you just do it once for the show, and 1 month afterwards you don't come back to do it, it's a waste of time. And I was saying that the best thing that most people should adopt is, let's take the school environment. Have as many towels as you can, then have many buckets with clean water. Put soap in the water and put some eau de javel in the water. Then you can take the rag, soak it in the water, and wipe the surfaces. You understand what I'm saying? Wipe the chairs, wipe the tables, the tops
of the market.
No. I'm talking of the classroom now. I'm coming to a respective. No, in the market, it's a difficult thing.
It's helpless.
I mean, we can argue about that, but I already told you that. Let me finish with this. You can question me about the market later on. I'm trying to give something useful.
Okay, go on.
Because you see, like the minister of
secondary education,
there are so many schools and people are afraid for their children. But there's something that we can collectively do to help reduce transmission in the school environment. Okay. And I started off by saying that
water should be put there.
Yes, it should be regular. Whatever I'm describing now should be done frequently, probably almost every day. All right, every day. Now, this is what we should do. Have water in a bucket. Put some soap in the water. Put some eau de javel in the water. Have many towels. You dip the towels in the water and you wipe all those surfaces. Okay? You wipe the tabletops, wipe the chairs, wipe door handles, then pour some of that water on the floor and then wash the floors out. That way you will wash out whatever it is. But know that you know, it will be if the germ were to be around, it will be contaminated as fast as you are cleaning. So you would want to do that as often as possible. Let me put it this way: just like the dust settles during the dry season on your stuff, that's just about how much you'll be getting back of the virus, in case there are some people around who are carrying it and are spreading it.
Okay, just to let our televiewers know that a lot has to be said about information communication technology in Cameroon and the world. On this program, as from 8:30, we are going to be having Professor Victor Mbarika, founder and president of Board of Trustees of the Information and Communication Technology University here in Cameroon. Is going to be telling us how very important ICTs are and what opportunities are out there for you if you were to try a hand on ICT. But let me take this one. Greetings to you, Mr. Leo. I'm Jude Bin from Douala. I think politics has overshadowed the control and spread of COVID in Cameroon. Their political ambitions are far more greater than the lives of Cameroonians. How can a government organize SHAN in the country in the midst of a pandemic and allowing spectators in the stadium? But there, we do not blame the government, we blame the organizers of SHAN now.
Well, we cannot really blame the government or the SHAN. You know, this thing was just coming back. The very person who is blaming the government, go and see, he's sitting in a bar now drinking. He's been demarcated. He has sent his children to school. So sometimes we just like to blame, but we don't take blame. We think that government is this thing that just has to be blamed for everything. But if you were to see what he is doing every day of his life, he himself is not doing anything to help. So please, let's stop this blame game.
Okay, so the issue is not the blame game. We should,
as
individuals,
find out what
it takes to stay safe.
Yes, everybody sits and crosses their hands. You do the wrong thing. You climb on a motorcycle, 4 of you. You are in a taxi. You're all there. You don't even wash the hands. You know that you've got to wash your hands. You don't wash your hands. You know that you have to have sanitizer. You don't do it. You talk into each other's faces, and then you are blaming the in other countries, and we are borrowing a leaf from them because we don't have any technology. We have neither the technology to make the vaccine, nor the technology to test the vaccine, nor anything. So we are like beggars, you know. And you know, so we just have to be attentive and listen to what others are doing.
It's also very curious that since the advent of COVID-19, that was last year, we are in 2021, and seemingly nothing is.
As a medical doctor, I would have to say something that I'm very disturbed about the diagnosis of typhoid fever in Cameroon. You know, from the time I went to medical school in 1977, you know, and I was training, and then I became a doctor, and I've been working, and up till today, I don't know how many years, more than 35, 40 years, I don't know. There's been something, you know, during the training, we would see a patient who has a fever, and the doctor or the professor training us, you know, they'll be very limited in their diagnosis, and they would tell you it's malaria or typhoid. You get what I'm saying?
Malaria, typhoid.
Yes, malaria.
Typhoid.
Whenever someone tells you it's malaria, typhoid, just know that the diagnosis has not been made. It's a sham. Are you getting what I'm saying? And then, for the 30 or 40 years I've been a medical doctor, the diagnosis of typhoid, you know that thing called the Widal test? That's not the diagnosis of typhoid. It's a sham. And if you were to calculate the amount of money that is wasted on antibiotics for malaria that is poorly treated, or for some other viral infection, or for some other source of infection, but everybody just lumps it with antibiotics and calls them typhoid, and then the fear that it had generated. Then when the HIV came, everybody who was HIV was hiding behind the typhoid too. So at the end of the day, even with things that are so gross, we can't even put our fingers on it. So talking about fine medicine, you know, when you were talking of COVID-19, is refined diagnosis and so on. It's very fine, and what you need to do should be really refined. But you don't have the technology, because the crude things, you are not doing them properly. Are you getting what I'm saying? So when the COVID came, like the medicine that was put out there by Bishop Cleda, our medical systems would have been testing them to make sure they know what is inside there and prove that they are working and so on, so that by the time the second phase is coming, we'll be ready with something. We'll be ready with something in our hands. Bishop Cleda's medicine was not tested scientifically.
No,
and
I'm coming to that. I'm coming to that. Yeah.
So these are the problems. These are the problems. These are some of them. We are just, the king is naked, I would say.
Yeah, but where is the problem? That I'm sure there are billions that are put into research in Cameroon, innovations. We have very brilliant doctors, researchers, and COVID has come. We're getting nothing from them, from our university centers.
If you watch the kind of research we do in Cameroon, it's always about attitudes or something, knowledge and attitudes of things. But we don't really push, you know, to find out the why, the hows about things. You know, what is in this? You see, like if we were really doing what we were supposed to do, someone could show up with a vial that contains, let's say, the vaccine that is not labeled, one that contains water, one that contains different things but looking similar, and we should be able to go through those vials and tell what they are in our laboratories, you know, quantify them and so on. Because even as we speak, you know, my fear has been this. I'm sure when those of you who are listening to the, you know, following up on the composition of the vaccines, what got me very frightened was that part of it that said that the vaccines contain some different nanoparticles, and that once you are injected, these nanoparticles were going to come together and begin to act like a chip. I mean, that was the part of it that frightened me most. And then, you know, that the vaccines they are making now, they are not using the traditional technology of making vaccines. It's a different technology altogether, where they take the virus as small as it is and they play around with it, you know, the people who know how to do it, and then get only parts of it and so on, and then put it into something, and then it's doing things. You know, the traditional way of making vaccines was they would take the organism, the full organism, and then denature it, and then, you know, pass it through some systems and becomes a vaccine. Like in Cameroon, you know, we make animal vaccines, but that technology you cannot use it for making, you know, the vaccines against something like COVID. So in terms of technology, we are still very far off. We are still very, very far off. And I think this is a wake-up call for us to build our units, some specialized units in our universities, in our major hospitals, and so on, and import this technology and import the professors that know what they are doing, so that they build our local staff so that we come up to speed. You know, and in our research centers, there's been a lot of research going on, sometimes some very useful research that is not put to use, you know, the agricultural research not put to use, medical research not put to use, research on this just wasting in our laboratories, and I think we just know how to waste.
Okay, we know how to waste. To answer the question you ask the doctor on the reason behind nations rushing after the COVID-19 vaccine, it's simply because this is the only pandemic that has touched the very high and mighty in our generation, and most importantly in Africa. It has forcefully stopped our presidents and top government officials from looting our economy through their frequent visits to the Western world. Please, if you're watching us and you have interest in understanding information communication technology, and you have brothers and sisters or anybody who is interested in having the best information on information communication technology, just stay put. We are going to be discussing this as from 8:30 with Professor Victor Mbarika, who is going to be telling us what opportunities that exist, the opportunities that exist in this field. Hi, Mr. Leo. How are we sure that the vaccine that the president of the USA took is the same one that they are about giving to people? To me, that vaccine thing is to reduce the world's population, especially Africa. Okay, those are conspiracy theories. Yeah, I don't know whether you subscribe to that. Good evening to you in the studio, Mr. Leo. Courage to you. It's Elvis Brown from Shell New Bell. Good evening to you, Elvis. Marie, watching me from Newtown in Limbe. Good evening to you too. Most Cameroonians have the I don't care attitude. My humble advice is that taxi men, bike riders shouldn't carry people without nose mask, and police should pull out people without mask in public places and cars, and delay for at least 1 hour. Ambele Alf is writing from Yaoundé. Yes, isn't it also worrisome to think that everybody has the impression that it is a ploy to reduce African population? Are there not other alternatives? Are there not other means to do that? Yes, the vaccination.
Well, you know that the African is sitting on a lot of wealth, and you know, it's everybody who wants to come to Africa and steal their wealth. So sometimes when they are saying some of these things, you don't just have to say no, because you know you can use very subtle methods, or you can just be brutal about it. But what we ought to be doing is to change our educational system and build our own youths, so that the human development index should go up, so that our economy should go up, because Africa is at the begging point, and we are only just going to help ourselves if we push our own education up, push our youths to learn the technology, have the character, have the respect for common good, have the respect for each other. It's a fight in the world where it's a fight of knowledge and technology, you know. But here we don't have the knowledge and technology. We are still at the level of spears, bows, and arrows. So someone is dealing with high tech here, and you don't have the technology here, and with his high tech, he can knock you off. Okay.
Good evening, sir. We should find out why African doctors and researchers can't come up with our own African vaccine. Must we always take account from Europe, America, Russia, China, etc.? Pascal is writing from Limbe. This brings me to the question that I had for you, which has to do with the Archbishop's Panesia, Bishop Kleda, and we also know of what came out of Madagascar, but today very little is said about it. Even in Cameroon, I don't know whether there was a follow-up of what was proposed by not only Archbishop Kleda, but other Cameroonians.
That's the question we are all asking. You know, do we wake up to situations? Do we, you know, did we pay attention to it? Did somebody pay attention to it? Did somebody do something about it? That's a question that we ought to answer. And we as a people, we are asking for answers to that. Did somebody try to do something about it? Because we have this laissez-faire attitude. Everybody just goes after the money and what have you, and nobody really goes after solving the problem. And when we have this mindset where we just keep running after money without actually paying attention to things that are happening to us, it's unfair. Because, for instance, I was reading on social media, someone was saying, let's suppose that Archbishop Kleda's medication was working very well and was actually effective, and we proved it. Then Cameroon was in a good position, you know, to make a lot of money selling that product to the rest of the world, you know, with everybody knowing that it is effective. I mean, that would have been a good opportunity, but we don't seem to do anything about it. And if it's an opportunity, then it goes past us. If we were to prove that it doesn't work, then we would say, please don't waste your resources, time and money on this, because it only puts you in a dangerous position. We are not in a position to say, yes, it's a great drug, or no, it is not. And then the sad part about it is, if you notice, when the when the COVID thing started, everybody kind of, even the pastors who usually pray for healing, everybody was hiding. And then after a few weeks, they picked up courage, and then many of our native doctors who are spread all over the nation, they started to cook up their own thing too. After Bishop Blair came up with something, everybody started to cook up something and then bottle them very beautifully and say, this is a treatment for COVID, is a treatment for. They just took the very thing that they were using, that the African Peninsula. They have that thing that cures 200 diseases, and then those change the labels again, and they say it's for COVID. How did you come about that? So you see, the quest for money sometimes just makes us crazy.
Yeah, but are you not also curious that till now no African nation can claim credibly that we have a solution to this?
Well, it has to boil. It boils down.
Lack of will or lack of know-how?
No, it's multifactorial.
Okay.
It's multifactorial. The first thing is, which I will keep on saying, and I hope it will mean something to somebody, is that our education is very, very weak, very poor. The level of technology is not good. And, this comes to push us to the wall. I mean, if you have African nations who cannot grow fish, who cannot grow rice to feed themselves, and their children are dying of hunger, simple things, who cannot irrigate, who cannot do simple things, then it becomes very, very difficult to do a lot of challenging things. Because talking about research and trying to do things for COVID, those things are expensive, and then it's high-tech stuff and so on. So we are saying that the crude ones, we have not been able to do the crude things out our nose, and therefore when you have the discipline to do the crude things at your nose and to show results, then it becomes easy for you to build on that and do the greater things. You see, you were talking about hygiene and so on. It's still very poor. I mean, I think I read somewhere that Yaoundé, a lot of quartiers in Yaoundé don't have water. We're in what is it, 2021, and we're still talking about availability of water in Yaoundé. I mean, and that has been a recurrent problem over and over and over and over. No public toilets, all those kind of things. So as long as you have not done the simple, basic things, it becomes very difficult to do the fine things.
Okay. Hello, Mr. KUM. It's Tabe, a lot of conspiracy theories about the COVID-19 vaccine. I have two things to say to people who speak negatively about the vaccine. The vaccine is fake, so what do you suggest? Okay. Good evening, Mr. Liu. I love your program. Is Desmond writing from Bamenda? Good evening to you, Desmond. Good evening, Mr. Liu. My question is that can't these African researchers do it? For how long we Africans will keep on depending with the white people? Okay, for how long do we keep depending on the white man? No, who is sending what flyer?
You need a broom to beat it off.
Okay. With the white people, Ngong Benedine writing from Ekondo Titi. Good evening to all of you guys watching us from that end, and in Mundimba. Not forgetting you, Didi Banderas, watching us from Kumba. Hello, Mr. KUM. It's Tabe, a lot of conspiracy theories about COVID-19 vaccine. Okay, I have three things to say to people who speak negatively about the vaccine. If you say the vaccine is fake, so what do you suggest? So maybe you should also stop taking anti-malarials and antibiotics from abroad. We must stop this attitude of conspiracy theories. It is not doing us any good. Thanks. Okay, good evening to you too. Good evening, Mr. Liu, watching from Limbe. Please, I wish to find out from doctor from his example on avoiding COVID-19 in schools. Cameroon generally has a lot of difficulties regarding water supply. How would that be managed, since quantities of water will be needed for that to happen? It's Akia Kennedy.
Well, the way there is a will, there is a way. Where there is a will, there is a way. Thank you.
Okay. Yes, when we want to do it, we can do it. And do it even
when we want to give excuses, there will always be excuses. But where there is a will, there is a way.
Okay. Good evening, sir. I'm Mr. Ndongo. From Bamenda, the Youth Day was postponed because of COVID-19, but still yet the government still goes ahead and accepts the famous musicians Fally Ipupa to host his concert in Cameroon. How are we sure COVID-19 is in Cameroon? Now, can we understand the reasons for the low deaths in African nations, Cameroon particularly?
Well, don't seek to know. If you try to, when you try to analyze, it doesn't make sense. Just say that it's God's grace. When you say it's God's grace, then move on from there to do the best you can to protect yourself. That's all we can say.
Doctor, was it not also necessary for our researchers, scientists, to have taken time off to understand why this is not affecting as many persons in Africa like it does in the West, so that we are living in a world of science? Let people understand why things work differently in different areas of the world.
I just told you that we are not committed to excellence. We are not committed to doing difficult things, and sometimes the finances are not there. And if you were to find out why it's not happening, I would encourage you to go to all our state universities and look at the laboratories. Okay, in the science departments, go to the hospitals and look at the laboratories. Go to those scientific research areas and look at the laboratories. They are very wanting.
Okay, they are very, very wanting. Should the government, are you calling on the government to step up? Are you calling on those who call themselves scientists themselves to take extra initiatives? Yeah,
we have to. I was reading somewhere that Japan, I think it's Japan. It's how many? It's closing. Was it how many universities? Changing from humanities to science and technology. And you see, when you come to a country like Cameroon, about more than 70% of everybody is doing to humanities and so on and so forth.
Sociology.
Yeah, all those sociology, physiology, all of those. It's time we switch things around and put more of our energies and our resources in science and technology. It's important. Once you do that, then it begins to reflect in high tech. But when you sway and put the power and put whatever you do mostly in the humanities, and then you put that in administration, which is not even digitalized, which is analog and commandement. In this country, technicians are not respected. It's commandement that is respected. We need to shift things around.
We need to shift things around. If these the vaccines were already, I don't know whether they were already in Cameroon, but we were going to administer Cameroonians with these vaccines. Who validates the credibility of these vaccines? Because seemingly we are now acting because other nations are saying there is a problem with blood quality. Yes,
that's right. When it turned out that they were bringing some vaccines, there's another social group that I belong to, the WhatsApp group. I'm with some professors, learned professors, and we were having these heated exchanges. And I was like, okay, Professor, do we have the capacity to check these vaccines and say what they are? And he said yes. And I said, okay, could you give me the names of the professors, the laboratories, and the university or the hospital? And so we kept boxing each other for quite some time. It was a very heated debate. And at the end of the day, it's just but normal to say that we don't have the capacity to test to find out what exactly it is and to for sure say what it is. And if someone were to insist to vaccinate people, even the people you say should go and take the vaccines voluntarily, if at all that were to happen, I would say that the government ministers who push it, and the professors and the doctors who push it should write an undertaking, to be responsible for the health of those people if something were to go wrong. You understand what I'm saying? If I were to do something to you and I'm certain that it's not going to hurt you, I'll quickly sign an undertaking that if something went wrong, I would take care of you or something like that. But if they are not ready to sign that kind of an undertaking, then you've got to be very wary. And for starters, they should be the first to take the vaccine.
Okay. Good evening, Mr. Liu. And doctor, can this picture best explain whether the vaccine real or not? Lots of uncertainties, Luther. writing from Limbe. Good evening to you. Luther, hello, good evening, Mr. KUM. The studio, telling security men to ask people to wear masks in public is a wrong idea because they themselves don't wear masks. Some of them collect money from people who have masks, claiming that they are not wearing it well. They are the ones making the situation worse, especially in the northwest and the southwest regions. Cornelius writing from where we don't know, but Dr. NGWANYAM, these conspiracy theories actually were in the air as early as February, March 2020. Many persons were already suspecting that this is something that has been cooked in the West with sole objective to devastate the population of Africa. But why did the reaction of Africans towards the polio vaccine?
It's unfortunate. It still boils down to the fact that we're just a African Union. The African Union is
setting
just
up a commission that was supposed to check whatever is
That's
coming.
right. African Union is just as good as the countries from which those people come from. So they just come from these African countries with their third world mindsets, and then they go and congregate in a house. They might be sitting in very beautiful places and air conditioned and so on, but their minds don't vibrate at that high frequency.
Yeah, but isn't that unfortunate? Was it not also an opportunity for African heads of state to rally around the proposal made by the
Madagascar president?
Yes.
Yeah, that it was, and then to put the money together and put all their scientists together in Africa to check to find out what it is. Like someone was suggesting at some time, it's possible that some white man came and bought it and took it to a lab somewhere, and they have been working on it, and they're way ahead of Africa. Yeah.
Okay. Hello. Guys, you guys are doing a wonderful job. Keep it up, Spirit. This is Eric Boston from Kutaba. This vaccine thing is not clear because we are not sure of the components of the vaccine and the test. The vaccine administered in USA might not necessarily be the same as the one administered in Cameroon. But if we stay away from this COVID-19 vaccines, are we going to also stay away from other vaccines from overseas? Theodore. Okay, good evening to you. Good evening, Mr. Leo. I love your program. How I wish good and extra measures vis-a-vis COVID-19. Citizens will be safe. Thanks, Roland, writing from Bamenda. Good evening, Mr. Leo. I'm Prince K from Kumba. I wish to ask what has happened to the research center of late Professor Victor Nomangu and his researches. Can't a solution be found from his researches that were left? Is that not also something to think about?
Yes.
He was doing so much.
Professor Nomangu was working on this Vanhivax for HIV.
For HIV, yeah.
And then he was also working on a couple of things for HIV.
Yeah.
No, not HIV, cancer. And when he died, I'm not so sure what has happened to that research project, but I don't think he had a lot of support from from the government or anybody as far as those projects were concerned. Yeah, because ever since he died, I think I've not heard anything about him again. So it's a little bit tricky and it's crazy, and we just hope that you know, we should start being more serious and you know, do whatever we can to promote our own stuff and make sure that we get to the roots of things. And the bottom line is, whatever it is, find the truth, find out the truth about it, you know, improve on it and make sure that it works. That's the way other countries have grown, through research and development, and then you know, making capital out of what you come up with.
Okay, but taking advantage of researches, and but why is Africa lacking in all of this, Doctor?
You know,
if the governments of Africa are not taking it serious, why do we not see private individuals also engaging, investing in this? We have persons like Dangote who are investing in cement and a host of others. In America, we have private individuals who are also investing heavily on this.
Well, you have to have a lot of money to go into this kind of research, and you have to know that you know, when you're talking about medicine and this thing, most of that is social. It's social, and you have to have some heavy capital to be able to invest in that. Of course, you are saying that someone like Dangote can begin to shed off some of what he's got. Baba Dampolo shed off what some of, and those Americans, yeah, they can. Then they pull that together and come up with one strong lab in Africa.
In Africa, yeah.
Yeah, that would make some sense. You know, like all these mega churches that have a lot of money. You know, bring some of that money.
A church that has 3 private jets.
Yes. Sell 2 of those jets and make the money available for this. So I get what you are saying. We have the capacity to pull in some resources and start from somewhere.
Most of our best brains are out of the country because they don't have the means.
That's right.
So if we have people who have the means and can catch these guys, say 20 best guys, let's work on this. But we have just been joined by Dr. Kwam Frank. C'est ça, no?
Yes.
Okay. Good evening and welcome. You're representing the MRC. We're expecting you here by 7 p.m. They're quite late. We have just 20 more minutes to go. We're glad to have you. Your first reaction to the COVID situation in Cameroon.
Okay. Good evening, everyone. And sorry for my late. Traffic jam is not easy in Douala. I had a lot of problem to reach there. And I thank you all for your invitation. And you know, COVID-19 pandemic situation in Cameroon is getting worse every day and days. I think about 2 weeks ago, we heard about the situation that in 3 months we had around 10,000 more infections. But in 2 weeks, we have more than, I think it's more than 7,500 new infection and with a lot of deaths. And that's the infection that are known. That are registered in the public centers. You don't register the people who are in private clinics who are healed there. And you know, if you take the real numbers, I'm sure it will be worse than that. So the situation is getting worse, and we should try to work so that everyone should wear his mask and try to respect all the barrier measures, because it's our only way to gain this fight. And if you have any symptoms, it's better to go to hospital instead of going everywhere taking every kind of potion. You know, a lot of people are dying out there just because they just go everywhere. Someone say take this thing, they take this one, they take a lot of them.
Où se situe le problème, docteur?
Le problème.
Pourquoi est-ce que ça ne va pas?
Je pense que c'est un problème dans le management de ces pandémies dès le début. Dès le début de la pandémie à Covid, les gens sont allés vers les hôpitaux. Malheureusement, on n'était pas prêt. On ne s'est pas assez préparé. Du coup, beaucoup de gens ont afflué vers les hôpitaux. Au départ, il n'y avait pas de préparation et beaucoup se sont retrouvés refoulés. Pour plusieurs raisons. La première raison, c'était qu'il n'y avait pas assez de place. La deuxième raison, c'est que même le personnel de santé n'était pas préparé à l'arrivée de la pandémie. Du coup, il y avait une certaine peur. Donc, et lorsque les gens arrivaient, beaucoup de gens décédaient parce qu'au départ, nous nous mentons pas même en Europe, beaucoup de gens sont décédés parce qu'on tâtonnait encore. On essayait de trouver un protocole qui va marcher, le mieux, et c'était vraiment, vraiment la panique. Donc, ce qui fait qu'au départ, et avec le temps, on n'a pas continué à rassurer ces personnes. Même lorsqu'on a essayé de créer les centres, on n'a pas tout fait pour que les gens puissent y arriver, pour que les gens sachent qu'ils peuvent être bien pris en charge dans ces centres et qu'ils aient confiance. Ce manque de confiance lors de la première partie de la pandémie a fait que, même maintenant, lorsque les gens sont malades, il y a de la place quand même maintenant dans certains centres. C'est vrai que ça commence à devenir saturé, mais même maintenant les gens ont peur d'aller à l'hôpital, et il y a aussi beaucoup de problèmes dans la communication sur cette pandémie. Je dois être désolé de dire qu'on a raté la communication, surtout dans cette deuxième phase. Si vous remarquez bien les débats maintenant, les médecins n'interviennent presque pas. C'est comme si on n'invite pas les médecins. C'est comme si la maladie ne concerne plus les médecins. Ce sont les politiciens qui parlent, tout le monde. Le Covid. Ouais, c'est la première phrase du message. Je crois que vous devez l'avoir reçu en passant. On vous dit Israël n'a pas de mort de Covid. Ça dit, il suffit juste de taper mort de Covid en Israël et vous verrez qu'Israël a eu beaucoup de morts au point de fois, je crois, 2 ou 3 confinements. Au point où Israël est le pays le plus vacciné au monde. Vous croyez que c'est parce qu'ils n'ont pas de morts qu'ils se vaccinent? Non, c'est parce qu'ils ont beaucoup de morts et ils ne veulent plus que les gens meurent. Donc ils préfèrent se vacciner. Donc on doit courir vers la bonne information, mais surtout on doit permettre aux professionnels de la santé, et surtout à ceux qui prennent parfois en charge ces patients au quotidien, de venir dire aux Camerounais, voilà, cette histoire est réelle, et c'est beaucoup plus grave que ce qu'on pense. Pour la deuxième raison, c'est que les cas maintenant sont plus difficiles à traiter que lors de la première vague. Ils s'aggravent plus rapidement. Lors de la première vague, quelqu'un pouvait faire 3 semaines avec la maladie éteignée. Cette fois-ci, en 4 jours, pour aider quelqu'un. C'est-à-dire, quelqu'un est bien là aujourd'hui, vous voyez, 4 jours plus tard, il est décédé. C'est vraiment beaucoup plus foudroyant. C'est beaucoup plus rapide. Ça touche beaucoup plus de jeunes. Au centre de Orca, il y a des enfants d'1 mois qui sont hospitalisés à Yaoundé. 1 mois jusqu'à 16 ans dans la population pédiatrique. C'est pour vous dire que les jeunes, on avait presque pas de cas d'enfants dans la première partie. Donc, les choses sont graves. Nous devons tout faire. Premièrement, portons toujours nos masques. Lavons-nous les mains lorsque c'est possible. Si ce n'est pas possible, utilisons notre gel hydroalcoolique. Et dès qu'on a le moindre symptôme, allons à l'hôpital. Allons nous faire. Je crois qu'on a quand même l'avantage cette fois qu'il y a des tests. Lors de la première vague, à un moment, ça manquait. Mais maintenant, il y a des tests et il y a quand même plusieurs endroits où on peut se faire dépister. Allons nous faire dépister si on a le moindre doute. Et si jamais vous êtes positif, ne paniquez pas. On va vous prendre en charge. En fonction des symptômes que vous présentez, on vous donnera un traitement particulier. Et si c'est plus grave, on vous amènera dans un centre où vous devez prendre en charge. Plus tôt la prise en charge se fait, et plus vous avez de chances de survivre.
Okay. What he's describing is also disturbing, very disturbing. When you look at the numbers that he is giving, he's a doctor also, giving very disturbing numbers. And that we have young people as young as 1 month to 16 years old is hospitalized, and we still find almost everybody living as if nothing was happening.
Yeah, so it's a little bit frightening. It's frightening, as you say. Je vais reprendre quelque chose que vous venez de dire là, qui est tellement important. Et pour dire que dernièrement, il y a un médecin en Consamba, il a fait une communication à la télé. il disait comme quoi le médecin doit rester en arrière-plan pour traiter et que c'est le communicateur qui doit aller au premier plan pour faire. Et j'étais à la télé, j'étais tellement furieux et j'ai dit non, c'est pas comme ça. Et je suis beaucoup plus ancien que toi. Lorsqu'on s'est formé au CUS, in those days, you for preventive medicine, people pay you for curative medicine, people are ready to pay for curative medicine. So because doctors' salaries and everything is poor and people are looking for a way of survival.
Because I know what I say is truth.
Mm-hmm.
You understand?
Mm-hmm.
But a lot of people are fear because they say, if I say something and the minister is not okay, he can transfer me somewhere that I don't know, and and this fear makes people to be afraid of talking the truth. That all what we are saying there, I think, is truth. We are living it. We are seeing it every day. You understand? And I also want to say to my colleagues at all, we are in a sector where we cannot lack work.
Yeah.
If you are a good doctor, you cannot lack work.
Yes.
Even today, someone is in the previous sector and decided I will never work again in this public sector, and I go to the private sector. He will struggle for 2-3 months, but after, if he is a good doctor, I'm sure patient will come to him. So we should stop that fear of saying truth to the people, because we are talking there. It's not for the government. It's not for the president of the republic. It's not even for our parties. No, it's for the population. We are there for them, to tell them to be very careful about this disease, because this is killing a lot of people, and a lot of people are dying in their home because they are afraid to come to us, because you don't come to like that and tell them that don't be afraid. If you have signs, if you have fever, if you have headaches, if you have this or this, come and go and do your test. If your test is positive, even me, I had COVID-19. I've been infected. It was not easy even for me, doctor. It's not easy, this disease. And I know if my grandmother has it, I'm not sure she will resist like me, because this can even only the weakness you have can kill you. You understand? And we should tell them. I'm young, perhaps that's why I'm a bit strong. I'm young, and perhaps I can afford it rapidly. But our grandparents, people are out there. You know, I don't understand why Cameroonians because, you know, someone he say I'm young, even if I have the disease, I will be better. But he forget to know that he lives with his mother, he lives with his grandparents. If he has the disease, he will come. He can either be asymptomatic and go and give to them, and they can die from this disease. I know we should be very careful. It's not for us only that we should take measures. It's for all the people, for all our environment, that we should take people. If you hear about families, you see some 5 people dying in the same family because they were just at a party like that, and the party and they said we said to them, don't go to there, but they go. You see 5 people died. In another family, 6 people are died. It's not easy. We are not happy to see people dying like that. Those people can give a lot of to Cameroon.
Okay. Good evening, Mr. Liu. Mercy writing from Mamfe. You talk about a mask every day. None of you is wearing a mask. Our distance is quite far. But if you
came with our mask.
If you were to come into the studio, you will see everybody has a mask around them here, please.
And then our I call it Jay. So
okay. So we speak about it, but everybody is aware and is moving with a mask. Let me take 2 messages and then. Good evening, Mr. Liu and Mr. Hans from Limbe. I must appreciate you guys are doing a good job, but there is an error if you guys are emphasizing on putting on a nose mask. I think you guys show an example by putting on a face mask shape, since you can't speak while putting on the nose mask. We are 3 of us in the studio, please. I don't know, can we have an open shot?
Yes, to see that we are more than 2 meters between us.
Eli, can we have an open shot, please? Can we have an open shot? Because we talk on TV and people may think that we are too close. Good evening, Mr. KUM LEONARD. Kudos to you and Dr. NGWANYAM. Please, my worries is this. When the Bishop of Douala discovered a vaccine in the traditional herbs, why did the government not provide the means so as to it goes to the regional Catholic churches and Catholic missions hospitals? Shu is writing from Nkwen, that is subsidizing for Cameroonians to have it. Good evening, Mr. Liu. Why do they give us the vaccines at the same time forcing those who have taken the vaccine to still put on masks? So why does the vaccine prevent when we are still asked to put on masks? Mike is writing from USA. That is also another. There's a risk of reinfection even after vaccination.
There are so many questions concerning COVID-19 and the vaccinations that have not been answered.
Yes.
You know, you can ask a battery of 10 questions to which the answers are not forthcoming. So it's one of those crazy things. You ask the questions, there are no answers, but you just go along with it because you know if you get it, it will kill you. Yeah. Okay.
That is it. Because there are persons who say there is no guarantee that if you are vaccinated, you still will not be infected.
You should understand the aim of this vaccination.
Okay.
Yes. You see, vaccination against tuberculosis. It doesn't guarantee you that you will not have tuberculosis. But it can guarantee you that you will not have a severe form of tuberculosis.
It reduces.
Yes, it reduces the amount of severe forms of tuberculosis in the population. And this vaccine is with us.
Okay, that is the open shot for those who are asking why we are not putting on masks. The masks are all there, but we are seated we support it. Yeah, Doctor, you were saying.
So I was saying that the COVID-19 vaccine, the first aim, is to reduce the mortality, to reduce the amount of people who can have severe forms, and then reduce the mortality. It's better to have people with asymptomatic forms than people with severe form, because if you are in places where we treat COVID-19 people, and you see someone with a severe form of COVID, you will cry because it's not easy. Even for us who are treating them, it's not easy because you see someone dying. You are doing all what you are doing, but you see his health going down days, hours and hours. It's not easy. You understand? So the first aim of this vaccine, because the disease is quite new, and the scientific in all the worlds are working. You know, it's not only one laboratory. There are a lot of lab who are inside, because the first aim is to make sure that if you can vaccinate all the population at the same time, so that we can stop the amount of severe form and the change. The first thing they want to avoid with the vaccine is to stop the mutations, because it's the things who is more dangerous with this pandemic. I think now we have around four mutations who are very bad. The South African mutation, the London mutation. I think now I heard yesterday about the Brazilian mutation. You know, it's not easy. So if you stop you try to vaccinate all the people so that the severe form reduce, and perhaps you can reduce with time, because they are continuing to work and to see the better vaccine to stop the contamination. If we reach to this vaccine, it means that we can stop the mutations, and then we can say, okay, now we are okay. But even for that, you should vaccinate all the people around the world at the same time, because if you vaccinate only Europe and you left Africa, there will be a mutation there, and when people can reach to Europe, and this mutation can resist to the vaccine you had, and then you have another pandemic. You understand the problems with the vaccine.
Good evening to you people in the studio. Couple writing from Yaoundé, please. I just want to ask, why is it that it's only America that produces vaccines? Don't we have professional doctors too? We Africans should base on accepting everything that comes from Europe. Unfortunately, we cannot, so we just have to bear. Good evening, Mr. Leo. The government officials and their families should be vaccinated first if the vaccines are good, as they claimed. Okay. It's not composed now, my brother. Good evening, Mr. Leo. People shall confidently take the COVID-19 vaccine, and if all the leaders shall take theirs first in the open. People are closely watching and waiting to see all the leaders, beginning from the toppest leader, to start taking the vaccine before they will take the COVID-19 vaccine. They are the ones scaring people. Nzika is writing from Mutengene. Good evening, Mr. KUM. You guys are doing a good job. Other vaccines can also be used, so let Africans not die because of ignorance. Emil Nga, writing from Yaoundé. Good evening, Mr. Liu. I love your program. More grace. Asong, writing from Limburg. Good evening to you, Asong. Good day, sir. Please let the government take this coronavirus with a lot of restrictions, because from my observation, I realized that most of people in power do not even respect the preventive methods of reducing the virus. That is why most people consider it fake. We have to end, unfortunately, at this juncture. Don't go away. We are receiving Professor Victor Mbarika, who is the founder and president of board of directors for the Information and Communication Technology University across the globe, Cameroon precisely. He's going to be telling us about the opportunities that we have for information communication technology. If you want to know what you can benefit from and how it can move you to getting better opportunities and jobs, please just stay put. We are going to be with him at 8:30 precisely. We want to say, Dr. Kwam Frank, thank you for coming.
Thank you, and sorry again for the late. It was not easy for me, but I had to be there, and I thank God to be there. I hope my message reached all the Cameroonians who were connected to this, and say them that don't be afraid of COVID-19 if you have it.
Okay.
Don't be afraid. Be afraid of having it, but if you have it, don't be afraid. Just go do your test, and if the test is positive, just go to the hospital and we will take care of you.
Okay, Dr. Nick, thank you too for coming.
Thank you very much. I have my hand sanitizer, I have my mask. We didn't put them on so that we'll be able to communicate properly. I guess you can get my voice. And so I encourage you to wear your mask and use your hand sanitizers, wash your hands. And to say that the doctors out there and the nurses, please communicate to patients, to the public, not just on COVID, but on all the diseases that we have. But of course, the emphasis is on COVID now, but it's our responsibility to teach the public, about disease in general. And you don't have to be afraid because politics has entered medicine. You are the boss. Like Dr. Frank was saying, even if you are dismissed from the government sector, the private sector is open for you. So don't be afraid to communicate.
Okay, you guys are going to take leave.
Yeah, we are.
And we are coming right back to discuss with Professor Victor after the break.